Let's move on to question 3. We've had a bit of an airing of this already, but tell us what the main group got to.
Hello, Julia Taylor from the NHS Institute. The first question was, should NHS managers be regulated as a means of improving the standard of performance? And the short answer is, I think we agreed no. And that immediately raised the rest of the questions. I think the fundamental issue was we wanted to be reassured that we had managers who were competent both in people management skills and in technical skills. And actually, would regulation do that for us? And we weren't sure that that was the case. We had a discussion around existing regulatory systems in place that have an impact on managers in the NHS, so therefore additional form of regulation wouldn't necessarily add anything. We also discussed very briefly what would be the possible means of reassurance around the competence of a leader stroke manager, and we came up with a range of different options. We're not saying that any of them were particularly viable. It wasn't our focus to identify that, and the challenges around the alternative mechanisms is that they're relatively expensive, and then you start discussing the returns on investments for that. So our conclusion was no, but we need to do something. We didn't find the answer within the time.
Okay, thank you. I'm going to go over to, do you want to add something to that?
Yeah, just a couple of points. I mean, the one thing to bear in mind is that there are already regulations that can be applied against managers under the Health and Safety at Work Act, and of course sanctions that are available to the other regulators as well. And all NHS organisations and all organisations generally are required to comply with the management regulations that sort of set the scene in terms of setting clear policies, roles and responsibilities, and so on and so forth. So, in theory, at any rate, managers should be working within that culture. And I think the other thing that we concluded that, the old adage, what gets measured gets done, was extremely important in terms of the code of conduct. And I think that point's been made already. All very well to have a code of conduct, but who's being measured against it? Does it form part of appraisals or whatever?